Hi, my name is Kathy, and I'm with the National Reye Syndrome Foundation. I want to talk to you a little bit about Reye syndrome today, and I hope that what you learn today you'll also share with other parents and caregivers. I hope that what you learn today you'll pass on to others, especially remember, kids and aspirin products don't mix. Reye syndrome is a deadly disease. It strikes swiftly and can attack any child, teen, or adult without warning. All body organs are affected, but the liver and the brain suffer most. While the cause and the cure remain unknown, research has established a link between Reye syndrome and the use of aspirin and other salicylate-containing medications. Reye syndrome is a two-phase illness because it's almost always associated with a previous viral infection, such as the flu or the chickenpox. Scientists do know that Reye syndrome is not contagious and the cause is unknown. Reye is often misdiagnosed as encephalitis or meningitis, diabetes, a drug overdose, poisoning, sudden infant death syndrome, and often as psychiatric illness. Here's what happens, but bear in mind usually 2 to 10 days after the child begins to feel better. Abnormal accumulations of fat begin to develop in the liver and other organs of the body and soon get into the bloodstream, causing severe pressure and swelling in the brain. Reye syndrome symptoms follow 4 stages. Stage 1 includes persistent or continuous vomiting. Then signs of brain dysfunction such as listlessness, loss of pep and energy, and drowsiness. Symptoms in Stage 2 include personality changes such as irritability and aggressive behavior. By the time we get to Stage 3, time is of the essence and we're critical. Symptoms include disorientation, confusion, irrational behavior, and combativeness. At Stage 4, your child should be in ICU at a children's hospital. The symptoms include delirium, convulsions, and coma. Reye should be suspected if this pattern of symptoms appear during or more commonly after a viral illness. Not all of the symptoms have to occur, nor do they have to be displayed in this particular order. Fever is not usually present. Many diseases have these symptoms in common. Physicians and medical staff in emergency rooms who have not had experience in treating Reye syndrome may misdiagnose this disease. The symptoms of Reye syndrome in infants do not follow a typical pattern. For example, vomiting may be replaced with diarrhea, and they may display irregular breathing. Also, don't give your child medicines that might mask these symptoms, such as anti-nausea medications. So what do you do if your child has taken aspirin or an aspirin product? Understand there is no test that can be done to see if Reye is present after aspirin ingestion. Know the symptoms of Reye syndrome and keep an eye on your child for the next 10 days to 2 weeks. Usually, after that time period, Reye won't show up. Push fluids. This is good for any child suffering flu or viral infection. Note that fruit juices contain minute amounts of salicylate, so try carbonated or seltzer water with a bit of pure cane sugar. It will taste like soda. You can dilute it with water, add a bit of Kool-Aid for flavor, or add a squirt of lemon or lime. It's like soda without all that corn syrup. Or use plain Kool-Aid or Jell-O where you add your own cane sugar. Then inform teachers, coaches, babysitters, and caregivers to report any vomiting or other symptoms to you immediately. If you need further information, you can always contact the National Reye Syndrome Foundation through email at the website at reyesyndrome.org, or you can call the foundation at the number posted on the site. Reye syndrome is a medical emergency. If symptoms appear, please take your child to the emergency room immediately, preferably at a children's hospital. The only means we have to prevent this disease is through education and awareness. There are some things that you can do, however. Check your medicine cabinet for products that may contain salicylates. Talk to your teenagers about Reye syndrome and aspirin. Talk to new moms about Reye syndrome, and also let them know that aspirin is transferable in breast milk. Share this video with family and friends, at school, daycare centers, and at churches. Help spread the knowledge that you gained today. Help save a life. If you feel our education and awareness programs, such as this video, has helped you, donate to the foundation at risesyndrome.org. You know your support is put to good use, and we thank you for viewing our video.